Hi everyone, this is Travis Sanchez. I'm with the School of Public Health at Emory University in the Epi department, and today we're going to do a quick run-through of a brand new website that we just launched, which is HIVContinuum.org. So I'm just going to give a quick background for the site, and then we're going to take a tour. If you have any questions, as Chelsea had mentioned, you can go ahead and put them in the Q&A screen, and we can take those as we're going along. So I just wanted to lay a little bit of groundwork about what the HIV Care Continuum is, and also how HIVContinuum.org fits into this. So HIV, as all of you are aware, the HIV Care Continuum is sort of the process by which we help us understand effective treatment for HIV infection, starting from HIV diagnosis all the way through to linkage, retention, care, response, and antiretroviral treatment. HIVContinuum.org is actually our inaugural project of the Powered by AIDSVu concept, which is taking our AIDSVu.org overall infrastructure and applying that to new types of data. So what HIVContinuum.org is a compilation of interactive online maps that sort of help us distill down the complex public health surveillance data into something that's more user-friendly and helps us improve our understanding of the care continuum outcomes in the cities. And the way that we do this is by mapping individuals that are engaged at each stage of the continuum by demographic groups for neighborhoods or zip codes within highly impacted cities. And this year, for this first launch of HIVContinuum, we're including data from these 5 cities, from Atlanta, Chicago, New Orleans, Philadelphia, and Washington, D.C. So just to give you a quick overview of the data that we have on the site. So we map these different steps in the HIV care continuum, so new HIV diagnoses, late HIV diagnoses, linkage to HIV care, engagement HIV care, and HIV viral suppression. The data source is from local health departments, surveillance systems, and as you can see here, we put this into an interactive website that tries to ease the interface and help visualize each of these steps of the continuum. And we'll go into more detail with the interface when we're on the live website. In addition to the mapping, we also have other important resources. So here on the left is a summary of the HIV care continuum maps in this grid format that allows us to visualize different populations as well as the different care continuum outcomes. And what this helps us to do is to get an overall feel for how population and care continuum outcomes are doing in the city as a whole. So just the orientation for this map is the indicators are all different, but the scale is all pretty much the same, which is the darker colors indicate the worst outcome in each of these care continuum steps. In addition, we, just like for the AIDSVu.org website, we also have the ability to map HIV testing and treatment locations on top of the maps that we have for the care continuum outcomes by dropping pins onto the maps. And this can allow us to help visualize how diagnosis and treatment resources are mapped out relative to those care continuum outcomes. And we'll talk about this again more when we go to the site, which is where we're going next. All right, so here is the live website. So as you can see, it's a relatively straightforward interface. We have direct links out to all of our maps here for our 5 cities directly from the front page on the website. I'm going to explore Philadelphia, so I could either click here on the map itself or click in the View Map tab. So this is the interactive tiled map, and as you can see, it's a little bit different interface for those of you who've used AIDSVu in the past. The reason why we went with this interface is because we have now multiple indicators, which are these tabs here for the care continuum outcomes, but we also wanted a way of being able to easily visualize the outcomes among other populations. So for instance, when we go to the Philadelphia map here, we're seeing new diagnoses overall for all persons in the city, but we also get these thumbnail views of the subpopulations for that same indicator of new diagnoses. So we see gender, male, female here, race, ethnicity, and age group all around the outside. If we see something in the map for those outside or for the subpopulations that we want to zoom in on, all we need to do is click on the thumbnail and it becomes the main map, so that way we can explore the map a little bit more. Also, this center tiled map is interactive, just like any other map that we're used to using on the web, so we can move it, we can zoom in or zoom out on that map. And if we wanted to get a really expanded view, we can also open it up into a full page. Again, with that same level of interactivity that we are used to on all of our other mapping tools online. I'd also mentioned that we have the ability to turn pins on for care or testing. So here I could just turn on the pins for HIV testing locations, and just like with the AIDSVu interface, this gives us more detailed information on these clickable pins, and so we can even click out to go to the website for these. So just showing a little bit of the interface itself, but we can go back to this main page. We can look at the care continuum outcomes. So when we were here on this overall map, we were looking at new HIV diagnoses. So if we wanted to look at other indicators, we could move through and look at late HIV diagnoses, linkage to care, engaged in care. We have two different suppression indicators. One is HIV viral suppression among those who are engaged in care, and one that is HIV viral suppression among those who were diagnosed, so among the whole population, including people who may not be engaged in care. Again, just like I had oriented you to the legend on the grid from the PowerPoint slides, all of the colors here for our legends are going in the same direction, in which the darker the color, the worse the outcome. So the scales will differ between the indicator, but the colors all essentially mean the same thing, which are the worst outcomes. In addition, when we're looking at subpopulations, we don't have to cycle through, going population and then indicator. It locks the population in the center tile. The center tile is locked in. And now, for instance, for African Americans in Philadelphia, we can look through the different indicators for that population. And when we switch, you also notice that all of the tiles switch as well. Now we're looking at link to care, and all of these thumbnailed images are linked to care in a different subpopulation. So the other thing that we had talked about in the PowerPoint slide was this additional utility for being able to summarize information across the city. So this actually came up from multiple tests that we did when we were launching the pilot project, in which we were trying to grasp some way of summarizing what we were intuitively seeing in the colors on the map. And so this is where we came up with the chart concept. And so what the chart does is sort of distills all that information into this graphic. And so again, just to orient you, each of the indicators are slightly different in how they're scaled, but for all of them, the darker colors mean the worst outcomes. And then we can see, certain aspects of the epidemic popping up. And so those can give us some additional detail about how people are doing at each stage of the continuum and how they are compared to other groups. The other benefit with this approach is when we see something that strikes our interest from this grid, the site was actually designed to be able to go immediately back to the map. So that was Hispanic and linked to care. And so when I click on that map, it goes back to that tiled map to give us the detail. So it allows a good flow back and forth between those things. The other thing I wanted to show you were our resources. So we have downloadable city slide decks for each of the 5 cities. They have their own decks with the overall maps for each of the care continuum indicators. So those could be useful for putting into your own documents when you're using this for discussing care continuum outcomes for these cities. And then we have, just like with our AIDSVu site, information about what the care continuum is and the details on the data methods about how each indicator is structured and whether there are any caveats with that data. I was going to pause here real briefly and see if anyone had any questions or wanted to see any particular part of the site.
Please enter questions in the Q&A box if you have anything for Travis to address.
Okay, we'll have a few minutes at the end as well to talk about this. The other question is, that often comes up is sort of what is the source of the data and what indicators are we using? There's a lot of different care continua out there with slightly different pieces of data that are being used. And I'll say because we're trying to map across multiple cities, the approach that we took was to actually use laboratory surveillance data in defining each of these care continuum outcomes. We tried to standardize the definitions as well as we could to other things that are being produced using that data, but we're not using any survey data or any interview data with either patients or providers. So we're looking essentially at timing of C4 of viral loads relative to diagnosis and also in current years. And so we have all the definitions actually below the legends here, and then if you want even more details, you'll find those within the data methods to describe those things. The other thing that people will often ask about is the amount of suppression or gray areas in here, and so the other thing to keep in mind is that we're dealing with pretty small geographic areas, and we're dealing with people who are diagnosed within a fairly short period of time, so a more recent period is 2007 to 2011. And so even in these large cities with large HIV epidemics, we're still dealing with relatively small numbers of people. And so we have to take care to make sure that we suppress data where it could be potentially identifying of someone. And so that's where you'll see a lot of the gray areas, particularly when we start breaking things down into the subgroups, subpopulations. So I'm going to just switch back, unless there's any questions. All right.
Travis, there's a few questions in the Q&A box. One is, how frequently are the maps updated?
So our plan is to update these maps every year. We had a pilot of this site in 2013 that launched in December 2013, and that was in DC, Atlanta, Philadelphia. And then we've just recently relaunched with another year's worth of data, and so we intend to do the same thing for these cities. So these 5 cities will be updated again by the end of this year.
One additional question, what is the difference between suppressed HIV engaged versus diagnosed?
Sure. So in the, let me go back. That way I can show you the difference. So in the suppressed versus the suppressed among those engaged, that means that we have at least CD4 or viral load on all of the people, which means that they were in care in that year, in 2012, and then we look among all those people who we had a CD4 or viral load on, what proportion of those actually had a suppressed virus versus had detectable virus. So that's the suppressed among engaged. The suppressed among the diagnosed is among all of those people who we know are still living, including those who are in or out of care, what was the proportion of those who we got suppressed? So it could include people who maybe didn't have laboratories run or didn't go into their doctor, or people who went into their doctor and just didn't have suppressed virus. So that's the difference between those two. So you'll see where the proportions are different. So we keep the scale the same, but you'll see when we look from engaged to diagnosed that we have some places where the proportion that has the worst outcome actually goes up. Actually, in this case, the scale is different, sorry, but the proportion with the greater amount of suppression goes up. So we have even some areas falling in that less than 30%. Whereas before, when we look among just those in care, more than 50% have suppression when we look at those in care.
A few additional questions. One is, have you thought about looking at this with a longitudinal approach instead of a 5-year cross-sectional approach?
So longitudinal approach being that we're adding data for individual years. And we do plan on trying to do some of that to be able to show trends or changes over time. We probably, the 5-year time frame is probably the smallest amount of time that we'll be able to look at in any of those snapshots, just because even at this level, we're getting a substantial amount of suppression with our data when we start breaking it out for the subgroups. But what we do plan on doing is taking these sort of sliding 5-year time frames. So essentially you drop the older year and add the newer year to the data.
Great, and one additional question about the suppression diagnosed first engaged. They're asking, how do you deal with the missing viral load in this approach? Are they counted in the denominator but not the numerator? Are they inputted?
Yes, so in the engaged calculation, they're not included at all. They're not included in the numerator or the denominator because we have to have had a viral load. And in the diagnosed, they are included in the denominator, but they're obviously not included in the numerator because we're only counting the suppressed, the people who we have evidence of a viral load that's suppressed. So that's where we get this difference. So the difference is probably for those who are just not engaged, who didn't see their doctor or didn't get a laboratory test done in that year in 2012. Okay. Any other questions?
Not at the moment.
Okay. Awesome. Great questions. So it's right in my wheelhouse, which is talking details about data. So, all right. So just the last slide, just a little bit of summary information. We hope that HIVContinuum.org continues to play a role in supporting the National HIV/AIDS Strategy, and particularly for the call to actually accelerate some of our progress along the HIV care continuum. And really, as some of you may have remembered, if you were keeping track of the report from the Office of the National AIDS Policy, is that HIV Continuum was actually recognized as one of the important public-private partnerships in the December 2013 report. So this is actually that pilot that I mentioned with 3 cities. And so it's already being recognized as a useful tool. The other things that we hope that the images will help to create increases of community awareness about how the problems and the gaps in HIV care continuum may be different in different areas of the city or for different groups in different areas of the city. And we think that that information actually will be useful for really trying to move towards more action to either prevent new infections in those areas or to improve our care continuum outcomes. And we really hope that public health officials, healthcare providers, and policymakers and researchers are going to be able to use this information and these improved visualizations to help us sort of plan better where we need to focus more efforts on prevention, testing, and treatment within our cities. And some of this additional information, these overlays, may help to improve that even more substantially. So that's what we have for today. And I just wanted to see if there were any other questions, either about the site or about any of the material we presented in the PowerPoint. Okay. You can, here obviously is the link out to the website. We tried to make this as easy as possible to be able to find. And if you have any questions, you can email the info@hivcontinuum.org. Also, you can connect with us. We're really working our social media connections through our AIDSVu linkage. So any of these would link out to AIDSVu. So, and we hope that if you guys have any questions, I can take those now as well, or you can send those also to the email address here.
An additional question is, when do you expect to add new cities, and how often will you be adding cities?
Sure, that's also a great question. We hope to be adding new cities every year. We are not entirely sure how many we would be adding. As many of you are probably aware, the data that we're using, the laboratory surveillance data that we're using to define these care continuum outcomes is actually a work in progress with surveillance systems, so it's not as well developed as counting the cases of HIV. And so not all areas have had enough duration with their laboratory reporting to sort of be able to capture that 5 years worth of data that we would need. And so the cities that, we're considering and, inviting for the coming year, they're ones we're having discussions right now about how much data they have, how, complete do they think their laboratory reporting is. So all of those details are things that are still a work in progress, really, for care continuum. And I think a lot of health departments would agree with that assessment, is that we're still trying to understand how complete our data is for that. So I'm only saying all of this because we hope to add new cities, but this will probably not be the rapid expansion that we've seen with AIDSVu, where we were able to add a lot of cities very quickly. We're working with a very mature surveillance system. So I think for this case, we're going to have a more slow burn to add cities to the site. And if you have any suggestions, if you're from one of the cities that wants to participate, then please get in touch with us, and we can start those discussions now.
An additional question is, do you have any global expansion plans?
So looking at care continuum outcome in other countries, and we haven't really discussed that yet. So if someone has an idea for how we could do that, maybe a country that has great data on this, then we'd be happy to talk about it.
And an additional question about working with rural jurisdictions in addition to cities.
Yeah, so we started with this HIVContinuum.org site, focusing on the highest prevalent cities. We feel like the information probably most relevant to local action and sort of understanding where resources need to be, refocused or increased focus. So, but we've had a lot of discussions with the health departments that we've already been engaged with about the utility of being able to do this mapping at either the county or state level. And so we have plans to look at that this year with maybe a few pilot states that have good data across, all the counties in their state. And so we're going to be looking at that possibility, and that would get to this issue of, being able to look at care continuum outcomes in more rural areas. So we're definitely interested in that. The other thing we're looking at is doing summary statistics of care continuum outcomes for either cities as a whole or for states as a whole as part of our profiling process that we already use on AIDSVu. So in addition to finding out what the prevalence of HIV is in the state, we would also have care continuum outcomes on those profile pages. So we're definitely looking at that for this year.